I am truly stunned at what we just did. This is now released to go into millions of people, and there are just some basic questions that we don't have the answer to, or I don't even know if we know the answers or if we're looking at the answers. I am stunned.
For background, so people understand this, the FDA advisory committee, you were on this for the Pfizer vaccine, correct?
Correct. Yes.
Correct.
So there's a 21 member panel that actually is an advisory to the FDA for all of these vaccines so far.
And there were, of the 21, 17 people voted to proceed with the vaccine. And you were one of the 4 who voted against it. So let's go back to that moment. What was it that caused you to have such reservations about the Pfizer one?
Well, first of all, thanks to your mom for following things. I have actually been called the Dr. Fauci of Michigan because of a group in Detroit area called the 313 Coalition. But yes, so the committee is there as independent scientists hired as consultants to give our scientific expertise to FDA as far as advisory. And I was vetted for that committee starting back in August. I'm what's called a temporary member, which is a 4-year process, a 4-year appointment, but it's temporary because I don't have to attend every single meeting. It's only those that my expertise is most needed. So I was there. I was notified probably in November that could I make the one for Pfizer, which was scheduled for December. And you may recall there was a lot of media about the vaccine is going to be reviewed. Pfizer's at the FDA. As soon as we get the permissions to release it, it's available. It's amazing that it's available. And so I actually asked the program officer, because I was new, do we really have the option to say no here? Because it seems like this is already a done deal. And she said, of course. She said, this is why we want you here as independent scientists to help talk about the data and make sure that needs to be done or is ready to be used. So I went in, I had reviewed the material. There were answers to questions that I did not see in the 110-page document that we were sent. And so I wanted to ask questions, and we were given, it was all virtual. We were given the process. There was not an opportunity to ask the questions because it was virtual, and the way you had to get in line by raising your hand. So if you were the 8th or 9th person, or I don't even know 5th, you may not get to ask the question. And so I never got to ask some critical questions like, does this block infection? For a virologist, that's a critical question, because if it blocks disease, but it doesn't block infection, then you still don't have the punch that you need to put down the epidemic. So that was the issue. There were questions that we just did not get to ask. And at the end of the day, when it was time to vote, we had also been told that we would get to explain our vote. So we would vote, we would get to explain our vote. And I thought if you need to re-vote again, then you can do that. But what happened was we were asked to vote. There were people who were concerned about Pfizer's request to have this used down to age 16. And so 3 of the no votes were from people who were concerned about that. I was concerned about not having some essential information that I thought was important to people, and particularly people of color who I knew had reservations about medical research. So my no was actually the only no that said, wait, not yet. We want to release this, but we're not ready to release it yet. Let's get a little bit more information. And we could do that by expanding the trials, the clinical trials, to include physicians and medical first responders and those people in long-term rest homes, but in the study, not to let the entire population have access to vaccines. So I gave the analogy, I would like to, rather than release the water from a dam, to open a small area to release it gradually, as opposed to releasing this vaccine that we didn't know some of the things about. It turns out that by the next week, Moderna, who was a week later, they answered some of those same questions, because by that time, FDA had revised the process of reviewing the timing. They had given us much more time to ask questions that were really critical to having high uptake of this vaccine. And so my no was a no, not yet. I'm a huge advocate of vaccines. I travel a lot in my research. I've probably had most vaccines that exist. So I wasn't trying to say, no, let's not use this vaccine. I was trying to say, let's get the information that will make the critical difference to whether it will work or not, and whether people will feel confident in taking it. That's what I was trying to do.
Other than your question about whether or not the vaccine actually blocked the infection, what were some of the other questions that you had about the Pfizer vaccine?
Yes, so they give us these vaccines are done in a shorter amount of time, and lots of scientists have come together to put their data together from different places. I explain it like if you and I were, three of us were making a patchwork quilt, and each of us was going to make our own quilt. But now we decided, let's just put our squares together and make it that way. That would still get a quilt faster, and it would still be a good quilt. So that's what happened with the vaccine. What I wanted to know is, in the 30,000 people that were in the Pfizer study, or 40,000 in the Pfizer study, what was the breakdown of people with underlying conditions? What was the breakdown of people of color? And did those people of color have underlying conditions? So I wanted to understand, how wide has this sample been? Because before that, back in July, we were trying to help people sign up for the trials, knowing that we don't know what will happen to us in any clinical study if we're not in the study. You understand what I mean? So people of color, the studies need to have a diverse group of people who are being reviewed as a result of the clinical trial. So I knew that people had some reluctance, and I wanted to know, well, how diverse was the panel? I wanted to know, do we know what the long-term effects are? And of course, we don't know, because we've not been using it for a long time. And so those were the kinds of questions that for me were very important. Does a vaccinated person still shed virus? Because that's going to affect the circulation. What do we know about things like autoimmunity? Is there any autoimmunity set up? So those were just questions that to me were very basic. And it's okay if you don't know, just tell me. We're looking at that. And many of the things we wanted to ask, it turned out, at least the next week, we learned the samples have been collected during the clinical trials. They just had not been analyzed yet. So these studies were ongoing. We just did not have the results, because we were trying to get to stop the war at the moment, which is people dying from COVID-19.
When you voted no, what was the response in the medical community?
Well, first of all, it was a strange meeting because, as I said, I thought that we were going to be able to explain why we voted yes or no. And the question was, do you think that the risk of the vaccines are greater than the risk of the disease, or are the benefits of the vaccine greater than the risk? That was probably the question. And so I voted my conscience. I'd already talked to people before going in about, what if I'm the only one that doesn't think this is ready? I mean, I wasn't anticipating that, but I always like to prepare for the worst so I can be prepared, having no clue that that was what was going to happen. I thought the vote was going to be more like 10 to 12 or something like that, maybe 10 no's, 12 yeses, or 11 yeses, or whatever. So immediately after the vote, the chair said, okay, the vote is 17 to 4 to 1. The motion passes. The meeting, and pretty much, thank you for your assistance, the meeting is adjourned. And it was ended. And we were on Zoom, remember, or some platform like that. So I was like, wow, did that really happen? We're done? It's approved? Oh my goodness. Wow. I was stunned. I really literally sat in the same seat, and I was like, did that really happen? Are we done? And then the phone started ringing, and I was like, okay. And I picked up the first one, and I looked at my email, and it was just crazy. It was like all kinds of things, all calls. Finally, I decided I am not going to respond to this. I'm going to write a media release, have it checked by my media person at the university, and release the media statement, because I'm not in any condition to talk to anybody right now, because I am stunned. I am truly stunned at what we just did. This is now released to go into millions of people, and there are just some basic questions that we don't have the answer to, or I don't even know if we know the answers, or if we're looking at the answers. I am stunned. And so that's how I felt. But I knew I had done the right thing. I got lots of phone calls from people who said, thank you for your courage. Most of the reporters wanted to know, what was my no vote also because of the concern for youth? And it was not. It was the concern for getting information that we really need to know to go forth with confidence.
Were you upset that more of your colleagues didn't ask the questions that you had?
I don't know if upset is the right word. I was surprised. Again, many of the colleagues had been on this panel before. So I was new. There were maybe about 5 of us that were new to the panel, maybe 6 or 7, I don't know. But I guess everybody has their own expertise. There are physicians, there's immunologists, there are vaccination people. I'm a virologist who studies entry of viruses, which is what the spike protein that is made in the vaccine does. It's involved in the initial binding of the virus to cells. So I guess I was surprised that the vote was what it was. And I wondered, how is it, am I being unusually cautious? And when I thought about it, I was like, no, this is going into millions of people's arms. There are only 2 African-American scientists on this panel. And I'd even ran through a advisor, what would happen if this other person voted yes and I vote no, and we split the Black community's presence here? And the person said, well, if you have to vote your conscience, and that's all that's really important. And that's exactly what happened. That person voted yes, and I voted no. So I was just in a place of like, wow, well, I did what I think was the right thing to do. I would do it again. I had colleagues from my university say, next time I encourage you to vote yes. This is a physician that it was on the wards. And I'm like, yes, I understand your position, but I also know there are millions of people who don't have anybody in the room, but those of us that are in the room. And if I have some hesitancy, I'm sure they're going to have some questions. So I'm sorry, I have to do what I think is right. And that's what I did.